Hi, good morning, everybody. Thank you for tuning into Viewpoint on 96.3 FM. We greatly appreciate it. If you want to call in with any questions or concerns, we do welcome them. We have two wonderful guests with us. The phone number here at the station is 217-648-5510. From the Logan County Health Department, we have Dan Cavi, our administrator, and we have Kara Davis, Director of Nursing. So welcome. Thanks for coming out to the Radio Ranch. So,
thanks for having us.
I greatly appreciate it. Yeah. I guess we just kind of jump in. The ECG screenings, that kind of holds special and dear to my heart because my son goes to Lincoln High School as a freshman and got tested, and I know how important this is. So how's that program going for the health department?
So it's called Who We Play For, and it is an organization out of Florida. And we actually heard about it because Olympia schools did it earlier this year. And so we reached out to Olympia and received the contact information. And we're able to get it here in Logan County, the rest of the Logan County, a few weeks ago. And we screened Lincoln High School, Lincoln Junior High, Mount Pulaski High School and Grade School, West Lincoln Broadwell, and Hartsburg-Emden. We are doing Mount Pulaski Zion this week and some rescreens for different reasons at some of the schools also this week. Mm-hmm. So it went really well. We don't know the exact number of how many we did, but I think personally, because I'm the one who did a lot of the screenings, I would say close to 500 staff at some of the schools and the students, and it was for those 10 to 18 at the 10 and up at the schools. And it was free. All of the schools did pay for the kids to have it done, so it was an awesome experience, and we're really hoping to be able to do it either yearly or every other year.
Really?
Yes.
That's neat.
Yeah, and this isn't something typically health departments do, but I know, Kara, and you could maybe explain how you stumbled onto it, but I think it's great that we're offering the service to the community. We're really trying to continue and always improve our involvement with the community. This is just another way we can do it. So
So we did. Well, Olympia had found one student who had a defect, and it was kind of a big one. So that that specific child was treated, and from what I've heard, they are doing well. And I know that one of the students that we were supposed to rescreen this week actually didn't want to wait for the rescreen for we don't know why we're rescreening them. It's either something's wrong with the picture of the ECG or the doctors wanted to see a little bit more. This specific child went to his actual doctor and had a ECG there, and they did find something.
Really?
Yes. So I don't know any of the details, and I just know that because it's a small community and people know people.
Right.
So,
but then again, just to touch base on that, I mean, we're saving lives.
Yes.
Really, and it's testament.
Yes, and ECGs are not part of your routine screening for sports physicals. So 1 out of 300 kids have an undiagnosed heart condition that they don't know about that could cause problems if they play sports. Mm-hmm. And that's actually how the organization was started.
So you touch base on sports, but these kids don't have to be in sports,
no,
do
they don't.
If some parents are going, well, my kid's in the chess club or, speech or, band.
No,
and
we say sports because usually that's where your heart is used a lot more, and there's a lot more strain on your heart during sporting
more high activity.
So, and then the organization was started because the people who started it, they lost a friend to an undiagnosed heart condition when they were in high school. He collapsed on the field and did pass away. So these individuals started this organization years later after college in memory of their friend.
That's neat.
Yeah, and I have a sister-in-law. She's passed away. She had a heart transplant, but they had a issue in their family that it was hereditary, I suppose, but her brother, John, who was 17 years old, was playing volleyball in the gym. This is out in West Virginia, where they're from, and came out of the gym to go get a drink at the drinking fountain. I guess collapsed, and he died.
Oh my gosh!
He was only like 17 years old. So yeah, something like this can really hit home.
Yeah. Well, no, that's great that we're offering this service. So you said we're doing Zion Lutheran there
In Mount Pulaski this
down on
week, yes.
Friday. So, have you done the high school over there yet?
Yes,
or no?
we did them. Yes,
Okay.
we've done everybody that we've reached out to and that have wanted to do it already once, and we're going to do some rescreens this week, and then Zion Mount Pulaski this
So
week.
you've been a busy bee, I guess you could say.
I have been busy. I like getting out into the community and doing things, though.
Yeah,
So
that's a neat outreach. That's
Yeah.
wonderful.
Yep.
So anyway, what other things do we have going on at the health department? I guess I can ask real quick. I know school's still in session. And I had a third grader tell me at the grocery store the other day, I've got 4 weeks left, just 4 weeks. But are parents starting to think about back to school immunizations yet or not? Or are we kind of gearing towards that
Well,
yet
we'd
or
like
not?
them to get an early start. This earlier in the summer, the better, because they can get right in and out. There's no appointment necessary at the health department, which was kind of unique. Not many health departments can afford that luxury to people, or so it's nice that people can just come right in. So if people can come in sooner, but if they all wait towards the end of the summer, then we're going to be pretty crowded.
Yeah.
So we really urge parents.
I thought I'd put that special plug out there for you. So.
Yeah.
in the next few weeks, I will be sending something to the schools to send out to the families for the kids, and they need shots for kindergarten, 6th grade, and senior year. And then those kiddos going into kindergarten, which is new in the last 2 years, is they actually have to have a lead test.
Really?
Not just a screening, a lead test. All of Logan County is now high risk for high lead in the kiddos, and that is new.
Oh, wow.
Before it was just we would do a screening, and if you fell in one of the zip codes in the county, or your house was older than 1978, or you lived with somebody who worked with lead kind of thing, then you would need a lead test. Now every kindergartner has to have a test.
Really?
So yes, and we do those, and we do a finger stick, which is a lot less detrimental to the children than a blood draw. So we do those, and that is included with your kindergarten shots. So that is kind of a long appointment. It's about a 30-minute appointment time, so just plan ahead.
There you So what do we have, Dan, coming up? You got a list.
Well, we have actually we started a sharps collection program through a grant through the Illinois EPA. So anybody in the public who is taking injectable meds and they need a sharps container, we are giving them out for free.
Okay.
And then when they fill the containers up, they can bring them into the health department, and then we will take that, and we have an arrangement with the company. They will properly ensure that they are disposed of. And then when people come back and bring their empty or their full sharps container, then we will give them another sharps container.
Well, that's wonderful. So
Yeah, and we've had some requests from the community to, it'd be great if somebody could do that. So it's a small grant. It runs through June, and we are looking at hopefully continuing that with the funding. Hopefully we'll have some continued funds, and we can continue doing that in the next year.
So they just pop into the health department there to get their sharps container then?
Correct.
So, or what do they have to do?
Yes, they just come in and get it, and if they have so a lot of times at home we'll tell them to put them in a laundry detergent container and then seal the lid with duct tape and throw in your normal trash. If you have those and you're doing that, you can bring those in and we'll dispose of them properly as well. What they're trying to do is to get them out of the landfill and try to prohibit people from getting stuck. And this is any type of sharp, a needle that you would use for anything, not just medications. So if you need it for your extracurricular activities, we will take that as well, and there are no questions asked. We don't even ask your name or anything. You can just come in and get the container and be on your way.
Wonderful.
Yeah, we have a drop box for oral meds at our door, but people have actually dropped needles in there, and it's like, please don't do that.
Ooh.
Yes.
Yeah.
And we don't want our staff handling any contaminated needles. So
Yeah.
we just want to remind people, come and get your sharps container.
Yes, but going off the med drop box, the DEA pickup day is the last Saturday of the month, and Mason County is actually doing a DEA pickup day. So we're going to actually take our medications to them that we collect for them to dispose of. So what we have outside it looks like a mailbox, and you just put any of your unused, expired, or unwanted medications in there, preferably just pills, no liquids, sharps, patches, anything like that. Stick those in there, and we will dispose of them properly.
Wonderful. Wonderful.
So, and we talked a little bit about school immunizations too. We just want to remind everybody we carry a full range of immunizations. So,
And we take health insurance, so not Medicaid, Medicare, and health insurance. So,
And then I also know, too, you are linked up to the doctors, and so they can pull up the records and see everything.
yeah,
So.
I always like to plug the shingles. Karen and I have talked about this, but anybody over 50 should talk to their doctor because shingles can actually affect anybody.
Right.
So if anybody over 50, talk to your doctor about that because we have the shingles vaccine.
we do, and now Medicare is paying for that. So it's a very expensive vaccine. It's a 2-shot series. You get 1 shot, and then 2 to 6 months later, you get that second one. And we really encourage that you to speak with your doctor about it. And like I said, we've got it.
Yeah, Dr. Carroll was on me, so I
yeah.
got mine.
I'm sure Dr. Carroll.
Dr. Carroll. Good for Dr. Carroll.
Love Dr. Carroll,
Yes.
but yes, he kept reminding me that, Dara, you're 50.
He's very
Go
proactive,
get your shots, so yeah.
That's one thing I'm looking forward to when I turn 50 is getting my shingles vaccine.
I know.
I've seen a lot of people get shingles, and I don't want it.
No, it's not pretty, but
Very
yeah,
painful.
it is. So yeah.
Yeah, but other than that, I know WIC is doing a couple things. Kara, you might want to elaborate.
So we have a breast milk donation center at the health department
Really?
through WIC. Yes, you'll need to call to get information on how that works because we just are the donation spot where you bring the breast milk in, and it's through a company outside of Lincoln that comes and picks it up and donates it to NICUs in the area. So that is a phone call that would need to go to Sarah at the health department, and she could tell you all about that and what needs to be done for that.
Because I've seen some things on social media, people saying, for one reason or another, we need breast milk. So,
Yeah, but
that's
this is not for that. This
That's not
is
for that.
This is donated to NICUs.
To NICUs, okay.
Yes, but and you have to go through a series of tests and lab
Right.
work and stuff just to make sure that the breast milk is able to be given to those babies. It's we don't want
any, yeah. Anybody. Yeah, I got it. Yes.
And these kids in NICUs, they just can't get the baby formula like you'd
Right.
buy over the shelf.
Well,
the
breast milk is just better.
much better for
Yeah.
them. Absolutely.
Yeah.
So we're glad to help that out. And then I know WIC is also doing a car seat program.
Oh, yes. Sarah actually also does that too. So she will, by appointment, check to make sure that your car seat is installed
Okay.
correctly.
So
So
neat.
Sarah will do that as well.
Awesome.
So, yeah.
Awesome. Well, we're going to take a quick time out, pay some bills, our sponsors, and we'll be back here on 96.3 with the Logan County Health Department. Welcome back to 96.3 FM. We have Don and Kara from the Logan County Health Department. I'm sorry about that. But anyway, talking about our wonderful health department we have. I mean, there's so many services, folks, that they have for us here to utilize. They're a great resource. And while we were off air, I learned that this week is Public Health Week. And so...
Yeah, we're celebrating it this week. The state has declared April as Public Health Month.
Oh, okay.
The actual National Public Health Week was the first week of April, but we figured since the full month the state's celebrating, we just picked a week, and we thought, well, the middle of April would be great for the health department. So, people are going casual, or we're doing some fun things. We had a lunch yesterday for the staff, so they deserve it. They work hard. So, but yeah.
Yes, and we will plug El Maz Catered. We had a taco bar, and it was absolutely wonderful.
They did a great job.
neat.
Yeah,
Neat.
so.
I didn't get that invitation. So
Sorry about that.
Sorry about that. Yeah.
No. So, yeah.
And then we're doing dress-up days every day. So today is Public Health Day, so we're wearing our public health shirts today.
And then you're going down to Springfield then?
Yeah, I have actually just I'll be at a conference, but I'm pretty involved with the Illinois Association of Public Health Administrators. I'm the legislative chair there. And we have to go over to the Capitol tonight. There's a hearing. So we really are trying to get more public health funds from our state legislation. Public health has been so underfunded statewide. Last year we were able to get $25 million, which was up because the previous year we only got 19 million. But if you divide that between 97 local health departments, that's really not a lot of money. And a lot of the money, the bigger percentages of the dollars go to the bigger communities and the bigger health departments. If you really think about that, $19 million was less than 1/10% of the entire state budget. I haven't done the math on the 25 million, but I imagine it's fairly similar to that. But we're hoping to at least get that or more. We're going to be actually pushing for a little bit more funding, and we have a couple administrators who will be speaking and testifying at this hearing, so I'll be joining them just to support them. But we really would love it if statewide local health departments could get more funding, because look at COVID. I mean, everybody leaned on local health departments.
They did,
and they really brought out how important we are to our communities. I mean, when people think public health, they think, oh, they're the people that give the shots, they're the people that come and inspect our restaurants or our new septic system that was put in. But we do a lot more than that. We do education. We do disease surveillance. There's 10 essential services of public health that we do that the public just is just not aware of. We do a lot of policy making. We work with our ordinances, and we work with partners, and we develop partners in the community. So there's a lot of things we really do behind the scenes that people just don't see.
Right.
So we're hopefully we'll get some more funding. We really hope the legislation will have it in their hearts to
open up the pocketbook a little bit more.
Absolutely.
Yeah.
Absolutely.
Yeah.
So I know, we'd love to get 30 million, love to raise that. 25 million still wasn't enough. Again, because we're looking at 97 local health departments statewide.
Yeah.
So, but yep. So that's a big thing. That'll be tonight. And, so look forward to that.
Wonderful. So what else do we have coming, or going on, I should say, at the health department?
I had a note down here because I can actually plug a couple things Kara's doing. And Kara, you can talk to it a little bit more, but you're starting to do CPR classes. You've been doing that for a little bit now.
Yes, I am a CPR instructor, so I do teach CPR. I have all of the supplies to do that. You just have to call, and we can schedule appointments to do that. And I do it right at the health department, or
do you do that on site? So, like, say a business says, "Hey,
if they want,
we need our
yes.
employees to be certified."
Yes, I do a lot at the Christian daycare. I've been there. I do all of their employees, so I go there. And then last year, IHSA put in a law that all of their coaches had to be CPR certified. So I would go to the schools, and I did that at the schools for a lot of their coaches.
So do you see that happening for IESA? Because I'm an IESA coach.
I hope so. I hope so.
Okay.
I do hope so.
I'm ready.
Yeah, and then also, did you want to say something about naloxone too?
Yes, so naloxone is the opioid drug reversal medication. It is a nasal. Well, that's what we have. We have nasal. There are 2 places in the county where you can get free naloxone. The one is a 24-hour access at Custom Family Cleaners on Woodlawn. There is a vending machine that has the naloxone, the red containers for your sharps, xylazine and fentanyl test strips for you to be able to test your drug for either one of those, and then also has resources for recovery, for meetings, just different things like that in the community. And we also have that at the health department. When you walk in the front door in the vestibule, we have those same things. And then Mount Pulaski Library is actually going to be having a 24-hour access after this week. Yes, you'll be able to go in their side door and receive all of those same supplies for free.
So, quick question, and it does look like a vending machine there at Family Custom Cleaners. Has it been widely used?
It has.
Quite a bit?
It has. It has. I don't remember the exact number. That is not stocked by us. That is stocked by I can't even remember the organization that stocks that one. But I
didn't mean to put you on the spot,
I can't remember who does it, but I don't know the exact number. But since it went into play in May, I know the last time we talked about it, it was over 300 doses have been taken from there. And I know that from mine at the health department, from my little table, probably at least that many, if not more.
That should be a wake-up call for our county,
Oh,
really.
yeah, absolutely.
That really does need to
that's
be.
one of our, that's hopefully in the upcoming years, we can really focus with our partners. I know you're involved a lot with our local partnerships. to combat drug use, abuse. So we were really, and then mental health's another thing too. We have a mental health advisory committee in the county that I approached our board with. I talked to Judge Wright, but when he was a state's attorney, we talked about the need for more mental health in the community, and we talked to our board of health, who approached the county board, and we decided to have a mental health advisory committee. So we meet every quarter. We're going to meet on May 9th. Public's welcome to come. We'll be at the health department. It's at 11:30. But we talk about some of the issues and what we feel the county needs to improve mental health in the community, and we will, take our recommendations to the county board. So right now we're looking at, I've been exploring the deflection program. I know they're doing it in Springfield. It's where people who are troubled, maybe they're drug abusers or they're homeless, or they could run into trouble with the law, they can feel free to approach a first responder like a police officer, who in turn would turn them over to a deflection specialist. The state does provide these deflection specialists who can guide them into the programs they need, and the goal is to get them the help they need before things get worse, number one, or before they become incarcerated. So I'm exploring that right now. I'm working with some local stakeholders. So we're hoping to get someone maybe in from the state to talk a little bit more about a deflection program.
So we don't have that yet then for our county?
No. Okay. And Sangamon just started theirs back in December, I want to say, or November, excuse me. They started in November. So we're hoping, and like I said, that's something we're looking at, and I know we'll be discussing that at our meeting on May 9th. So just a couple other quick plugs too.
Yeah, sure. Yeah,
but I know the weather's getting warm. With temporary food, people will be, serving food at festivals and fairs. If they are running a temporary food service operation, be sure, no matter what you're doing, call the health department ahead of time to see if you're required to have a permit or not. If it's a one-day event, we don't charge a fee, but we do require they have to fill out some paperwork. If it's more than a one-day event, then there's a fee that gets tacked on, and then we have to come out and do an inspection. But please call the health department if you're planning to do that. And then food vendors or food establishments are required to have a certain number of people who are certified in food safety. And I just want to remind the food establishments in the community that if they need to get anybody trained, they can do that through the health department. Just call Faye Allison at our health department at 735-2317. And then she offers classes throughout the year at the health department. So we do that for our food establishments too.
Wonderful.
And other thing is just want to remind people the SIU Center for Family Medicine, going strong. We just celebrated our 7th anniversary, going into our 8th year with them already. It's hard to believe it's been 8 years.
That
going
is,
into 8 years here. But for medical or dental, it's all under one roof. You have public health, medical, dental.
One-stop shop.
It's a one-stop shop, absolutely. And then I want to also encourage people, if they want to know more about the health department and our services, they can always go to our website, which is www.wlcdph.org. And there's a lot of good information. If for instance, I have an environmental health background before I took over administration, but if somebody wants to get a permit for a septic system, all they got to do is log right into there, go under septic, and it tells you exactly what you need to do, what's your first step. Same with if you're going to open a restaurant. It takes you step by step what you need to do. You need to complete a plan review and so forth. So it's really a good 24/7 resource.
Neat. So real quick, do we have RSV vaccines there at the health department
Yes, we
too?
do. Yes, we do. For those 50 and up.
50 and up.
Yep.
Jim,
No, I'm sorry. 60. 60. RSV is 60.
Jim wants to know what's RSV.
So RSV is usually something that only affects, they thought only really affected and did damage to babies. During COVID, they would test for COVID and flu and strep, and they started testing for RSV and found out that those that were over the age of 60 had RSV, and it was putting them in the ICU on a ventilator, and they used to just not know what it was. Like, you have a virus and it affected your lungs. Well, they found out that it's RSV, so they came up with a vaccine for it. This is the first year for it, and actually we've done pretty well with giving that to those 60 and older. We're not sure if it's going to be just a seasonal like the flu and you'll get it every year, but as of now, it's just a one and done, but that could change.
Neat. One-stop
yes.
shop for you, Jim.
I guess I got a bunch of shots.
You got to get a bunch of shots.
We actually don't do RSV. We don't do shingles with any other vaccine because you could be kind of put under the weather with that one. So shingles is you get that one and then you can come back 2 weeks later and get another.
We're going to get you taken care of, Jim.
We got you covered, Jim.
So anyway, well, I appreciate both of you, Don and Kara, so much for coming up here, and and the great resources that our county health department offers. I mean, it's a vast array. So
Well, thanks, and really appreciate that. And it wouldn't be possible with the great staff, people like Kara and other who works at the health department. So, credit to them, and we really appreciate serving the community, and we always appreciate the community support.
Yeah, it's wonderful. Well, folks, thank you for tuning into Viewpoint on 96.3 FM. The Lord and weather willing, we'll be back next week.